Good morning, and thank you for joining us for the webinar COVID-19 Vaccine Myths and Misconceptions, sponsored by the Salt Lake Chamber's Roadmap to Recovery Coalition. I'm Scott Parson, one of the chairs of the Roadmap to Recovery Coalition and the CEO of Staker Parson Materials and Construction. For those that do not already know, the Roadmap to Recovery Coalition is a business-led coalition focused on implementing and promoting our economic recovery. During today's webinar, we will hear from healthcare professionals about the truths and falsehoods of the new COVID-19 vaccines, how Utah classifies an essential worker, and more. Today, we are very pleased to be joined by Dr. Angela Dunn, the state epidemiologist for the Utah Department of Health, Dr. Amy Kahn, Executive Medical Director for Regence BlueCross, BlueShield of Utah and BlueShield of Idaho, Dr. Donna Milavetz, Regional Vice President of Steward Healthcare, and Rich Lakin, who is the Immunization Manager for the Utah Department of Health. And he will be filling in for Dr. Dunn after she has to step off for another meeting. We're looking forward to an informative session, and we invite your questions that you could submit through the Q&A or the chat function. We'll do our best to answer as many questions as we can. This webinar is also being recorded and will be made available on the Salt Lake Chamber's website. We'd now like to invite our panelists to each take a few moments to introduce yourself and to share your perspective on some of the myths and misconceptions about the vaccine. We will start with Dr. Dunn and then move to Dr. Kahn, Dr. Milavetz, and then to Rich. Dr. Dunn.
Sure, good morning, and thank you so much for the opportunity to talk with you guys. I'm Dr. Angela Dunn. I am the state epidemiologist at the Utah Department of Health. And the biggest concern I am hearing from the public is, how do we know this vaccine is safe? It seemed like it went through trials way too quickly, and there's so much political pressure to get it out quickly. Did it really go through all of the necessary steps to ensure safety? And I will say that, yes, it went really fast, but it did not skip any steps that any other vaccine had to go through. We just did it a lot quicker, which is amazing. I mean, it is so incredibly amazing that we identified this virus a year ago, and now we have several effective vaccines against it. I think it's a testament to what we can do as a country, but also worldwide. I mean, we had partners come to the table really quickly and early on to start discovering what is the best way to create a vaccine against COVID, and we've done it. And all the same FDA regulations and phase 1, 2, and 3 trials to ensure safety and efficacy. And I'm obviously confident that it is safe and effective. Have already gotten my first shot. But when I hear that over and over, it makes me very nervous that people don't have the confidence that they need to have in order to vaccinate themselves or their loved ones. So I will assure you, it went through all the same steps as everything else, just in a much shorter and quicker time frame so that we can curb this pandemic quickly.
Well, thank you, Dr. Dunn, and thank you for your service through the past year. It's been remarkable. I also want to thank the Chamber and Scott for the opportunity to join you all today. I'm Dr. Amy Kahn. I serve as the Executive Medical Director for Regence BlueCross BlueShield of Utah and BlueShield of Idaho. I'm an internal medicine physician by training, but I'm also a medical epidemiologist. Like Dr. Dunn, spent about a half a dozen years or so with the CDC. So for me, being able to serve in this role, to serve employer clients such as many of you at the Chamber and others, to be able to provide and assure high quality care through an extraordinary time has been a part of my passion. As I think about the myths and misconceptions about the vaccine, I think for me, from a public health perspective, I like to think about this as being, yes, one more very critical tool for us to help control the spread of this novel infection and disease. And yet I also want to make sure that we remember that there's still an important role for behavior and taking those precautions to help reduce the spread, identifying cases and doing that contact tracing, and then ultimately managing people who have risk factors, whether due to chronic disease or older age, who we know are going to be the ones that are most vulnerable for the more serious consequences, even leading up to death. So for me, I like to think about this as just such an incredible advancement, and yet one that we need to also think about in the context of those other important strategies to make sure that we can get back to our businesses, back to our lives and our livelihoods.
Hi, everyone. My name is Dr. Donna Milavetz. I'm the Regional Vice President for Steward Healthcare Network, and I'm really privileged and honored to be here today. I will echo Dr. Kahn's gratitude for Dr. Dunn and the incredible work that the health department has done during these really unprecedented time. I am an internal medicine physician also, and I'm deeply passionate about really the health and well-being of our communities. I can say that from my perspective, I would also not only echo what's already been said, but just this idea of optimism, that we have now a new tool in our toolbox that is effective, and that we have this now light at an end of the tunnel, if you will. And not that there's probably ever going to be an end date for COVID, because I think that it will be prevalent in our communities for a while. But I do think now we have a very powerful tool that we can use to help others. And so I am really excited to be here to really help the community understand a little bit more about the vaccine, to gain confidence in it. And then the question I think I get asked the most is, where can I get it? When can I get it? It's so unfair. Where am I in line? I am pleased to report that I have actually gotten my second shot of the Pfizer vaccine this past Monday. So I'm happy to talk about my personal experience as well with it, but wildly optimistic about the future.
Hi, and I'm Rich Lakin. I'm the Immunization Director at the Utah Department of Health. And, I echo everything that these great doctors have said. There's really not much more to add, but regarding myths and that, this is something that we deal with all the time for all immunizations. And I can tell you that social media such as Facebook, Instagram, LinkedIn, YouTube, Twitter, TikTok, I mean, we can go on, and all these are not the greatest sources of information or vaccine. And that's where a lot of people get their information. And so it's very important that when we get this information about vaccines, that we go to the real source, one of the leaders in diseases, which is CDC, which provides good documented scientific information about vaccines, and then also on our website at the Utah Department of Health, and along with that, Steward and Intermountain and all them, they can provide the most valid information.
Great. Well, thank you very much for your introductions and your initial thoughts. Dr. Dunn, if we could first turn to you and maybe have you tell us how you feel the vaccine rollout is going in Utah, maybe how we compare nationwide. There's a lot, many different stories and viewpoints in the news. Maybe you could share your perspective on behalf of Utah for us.
Sure. I mean, I think we all feel the slow start nationally for the COVID vaccination rollout. I know that we are picking up steam so readily here in Utah, and that's because our local health departments now have vaccine in hand. Initially, it was given to healthcare workers and hospitals, and that's perfect, right? We wanted healthcare workers to get their vaccine as soon as possible and be in the front line to get that. But that's a small percentage of our population. And hospitals, for the most part, aren't set up for mass vaccination. Our local health departments are, and they now have the ability to set up these mass vaccination clinics and are picking up momentum. Most sites doing, they can do up to 1,000 a day, and that's incredible. And so as we're getting more supply coming in for our vaccines, that's obviously the rate limiting step. Our local health departments will be getting it out as quickly as possible. And we've seen, I mean, Rich can attest to this too, we've seen in the past couple of weeks, our locals really stepping up and getting the vaccine out to those priority groups. Right now, we're on EMS providers and first responders, in addition to non-hospital healthcare workers. And we will be expanding those groups in the coming days and weeks. And all of those people will be able to go to our local health departments and get that done. So I echo, Dr. Milavetz saying there's a lot of hope moving forward, because this is what our local health departments are good at. And I have all the confidence in the world that we will be using up the vaccine as we get it moving forward.
Great, thank you. Maybe you could also address how notification will take place, so different groups know when they are eligible to receive the vaccine, and how they should go about, either signing up or where they should go to receive it.
Yeah, absolutely. So we will be doing press releases, and in addition to press conferences, and the coronavirus.utah.gov website will be up to date with where we are in the priority groups that will be vaccinated. A lot of that, again, has to do with supply and uptake. And so we will be moving through those groups as quickly as possible. In order for individuals to sign up for the vaccine, it's important that they know what local health department that they're part of, and they can find that on the websites. And that local health department has individual information for how to sign up and get the vaccine. Some have call centers, and they're all working towards an online scheduling system as well.
Okay, great. Thank you very much. Dr. Kahn, if we could maybe turn to you and ask if you could help explain for us how this vaccine works. And is it similar, or how is it different from other traditional vaccines that we might be more familiar with?
Great question, Scott. I think we've all heard that this is a novel vaccine platform. Of the 2 vaccines that have been approved or authorized rather for emergency use, the Pfizer and Moderna vaccines, they leverage a messenger RNA technology, which is new in terms of it being the first authorized, if you will, in the US. But I want to really reiterate that research has gone on for at least a decade or more on this particular type of platform. Messenger RNA, which is essentially a fragment of genetic code that we get in the vaccination, that our cells then translate into the production of what's called the spike protein. The spike protein is really the antigen on the surface of this virus that then stimulates our own immune response, that is the production of antibodies that allow us to confer protection or immunity if we should become exposed to this virus. So it's an exciting new technology, one in which we know has a very good safety profile. A terrific amount of safety data were obtained with the platform, and in the trials has shown exceptional vaccine effectiveness, which is a really important piece, particularly as we see these first 2 approved or authorized for the initial rollout. Now, these platforms are different than what we have in our traditional vaccines. Many of our traditional vaccines use a weakened form of a virus, or a killed virus, if you will, or even a protein subunit to then stimulate that antigenic or immune response that an individual then would confer protection. At this point, I think one of the big questions that many have is, well, how long am I going to be protected? And that is one aspect that we simply don't know at this point. We certainly anticipate that we'll learn more over time. As we know, we've only been living with this novel virus for just a year. And certainly we know that the vaccine has now been into the arms of people now for a couple months or more, if you look at those who are in the trials. So we hope that this will confer a durability of immunization or vaccine protection for at least a year or so, maybe longer. And I think time will tell if we need to take a booster, or think about this more like our annual flu vaccine shots that might need to be administered more frequently.
Maybe along with that, is there any possibility that it would be combined with, a flu vaccine if it comes down to that we need to have an annual type of a shot, or would it likely be two separate things that we would need to take to protect ourselves?
Yeah, at this point, there's a couple things that we want to remember. This is a new technology, and we really need to have a substantial amount of experience under our belt before we start combining it with other, agents. And I think we can all appreciate, even though this has been authorized for emergency use, we have a terrific amount of ongoing surveillance, both active and passive, if you will, to identify any particular adverse events, any contraindications, any other consequences. And we still need to continue to gather that information. So I don't have a crystal ball here to say if and when that might happen, Scott, but I think at this point, particularly due to the novel nature of this, I think we're going to want to keep it separate for a while just to make sure that we are clear about what its safety profile is and make sure we're clear about any other long-term issues.
Okay, great. Thank you. Dr. Dunn, a question has kind of come up based on Dr. Kahn's reference to the flu vaccine. And we do hear a lot of reports in the news that the incidence of flu is significantly reduced this year. And just wondered if you could comment on that. Do you expect that trend to continue? Is there some seasonality we should be aware of, or what are your thoughts there?
I think we are so fortunate that flu has dropped off. Every single year, our hospitals get stressed during flu season. So we are very fortunate that we are not seeing the high levels of flu yet, in addition to being stressed with COVID. We know that COVID measures stop flu. They're both respiratory viruses. When COVID started last spring, right when we implemented kind of mask wearing and social distancing, our flu cases plummeted almost immediately. So these measures are really good at preventing flu. We also know when we look at the Southern Hemisphere who has flu season before us, studies from Australia, for example, they had a really mild flu season because of the COVID measures that were in place. So if we continue to physically distance, wear masks, stay home when we're ill, we will protect our hospitals not only from COVID, but also from the flu as well. I think this also shows, so then the next question is, well, why are COVID numbers still rising? And I think this shows that COVID is just much more transmissible, much more infectious, if you will, than flu. It's easier to get infected with COVID than flu. So it's really important that we continue these measures to protect our healthcare systems from both respiratory viruses.
Great, thank you very much. Dr. Milavetz, if we could turn to you, and one of the things that our Roadmap to Recovery Coalition and our members are most concerned about is the economic of the virus and the pandemic. How do you see the vaccine distribution kind of governing people's return to the office, restaurants and stores being able to increase capacity and service? And maybe along with that, do we still need to follow health and safety guidelines in the workplace? And how long would you envision that would continue?
So great questions. I'm going to start with the answer to the second one first, which is until the foreseeable future, until we get to, a 70% vaccination rate in our communities as a whole, that herd immunity that we all hear about. I think it's important that our masks and our social distancing and our good hygiene of hand washing is going to be with us for a while. And I think that we just all need to get our minds right and headset with that, and really doing our part with not only supporting businesses and supporting each other, but to make sure that we're very, very mindful of that. I think that as the distribution of vaccine continues and our risk groups are vaccinated and get that second shot, that we will be able to, as time progresses, depending on the frequency of how quickly we get, shots in arms, if you will, that we'll be able to start to loosen those measures. But I really want to set realistic expectations that, through the fall of this year, maybe through all of 2021 would be my expectation, that I would anticipate that we would continue to use masks, to have employer groups continue to institute that social distancing and to do surveillance programs as necessary to keep people safe.
Okay, thank you.
May not be the best news, but I think it's important to know that if we all do our part, our businesses can stay open and our restaurants can stay open and we can still do takeout. But we don't want to go backwards. We want to go forwards. Okay,
Yeah.
bye now.
I think it's really important to be realistic, and I appreciate your perspective. I think that many people thought that January 1st we were going to, enter a new year and things were going to be significantly different. But in many ways, January 1st was actually December 32nd. So we need to continue to be vigilant, and as business leaders, it's important for us to understand that and how we can help contribute to conquering the virus and the pandemic. Rich, this is a question maybe if I could address to you. We frequently hear a lot of concern about vaccines and about long-term risks of vaccines. And just wondering if you could address some of those concerns and kind of weigh the pros and cons in the dire circumstances we're currently in.
Yeah, so, in regards to, it sounds like the question is more in regards to vaccines, the long-term consequences. So we have lots of data that show most of the risk that an individual receives when they get a vaccine is usually within the first 15 minutes. And that could be, a severe allergic reaction or, long-term. When I say long-term, it could be days where their arm is very sore or they get a slight fever. Those are, a slight fever, a sore arm, those are just natural reactions that mean your body is building up an immune system to it. We track every severe illness, even if somebody believes that a severe illness is a sore arm from a vaccination to a severe allergic reaction to it, we track that through VAERS, which is a vaccine adverse event reporting system. And we also have another piece of this that's called vSafe for COVID that is specific to ensure that the safety of these vaccines are tracked and that we are not missing anything. So for the long term, that's part of the system that we have, is that VAERS and vSafe, not only for COVID, but for all vaccines. And then vSafe is specific for that. And again, for the short term, there have been a few cases where some people have had some severe allergic reactions, but they have recovered fully and they were fine and went on with their day.
Great, thank you. Dr. Dunn, before we're going to lose you in a few minutes, could you address the new strain that we're hearing about, and are we aware of any cases in Utah, and what if anything should we do differently as a result of this new information?
Sure. So the first thing I'll say is that viruses mutate. That's normal. COVID has been mutating since we identified it. Oftentimes those mutations mean nothing in terms of who they infect, how severe disease is, how transmissible it is. So what's really important about that, there's actually two strains that have caused alarm. One is a South African strain and one is a UK strain. And what we're seeing in those strains, specifically the UK one, is that it does appear to be more transmissible. It's easier for people to get infected with this strain than previous strains of COVID. It doesn't appear to make disease any more severe, but it does mean that more people can get infected more quickly. We've started to identify this strain throughout the US. We have not identified it in Utah yet. I will give our public health lab kudos here. In Utah, we actually have really robust ability to actually genetically sequence our viruses. And so we have been tracking that. So we will be able to identify it readily when it's here. However, when you talk about interventions, it's the same thing, unfortunately, that we've been saying for the past year. Wash your hands, wear a mask, stay home when you're sick, physically distance. And once we start identifying the UK strain here, which we will, those interventions are even more important because it is more transmissible, and it will cause a surge in cases that we know, 2 to 3 weeks after that will cause a surge in hospitalizations. 2 to 3 weeks after that will cause a surge in deaths. Those are the epidemiologic principles that have been consistent throughout this pandemic. So we're actively looking for it. It's here in the US. It's likely here in Utah. We just haven't identified it. And if it's not, it will be coming soon. So it's even more important to have those behavioral principles at the forefront of our mind every day as we move forward throughout the winter.
Okay, great. Thank you for that information. Dr. Milavetz, if we could come to you, and I think given your experience having just had your second dose, maybe you could share just a little bit about your experience and how you would maybe parlay that to help create confidence in the community to take the vaccine, both for, in our businesses and in our homes.
Absolutely, it'd be my pleasure. So first of all, at Steward Healthcare, it was important that we had a plan in place before we ever had vaccine hit the door, and a strategy on which to distribute that vaccine in a very easy and efficient way. So we set up a technology infrastructure that alerted health staff with an electronic notification. You were able to get into a portal, answer some questions about your particular individual risk, and then from there scheduled an appointment. I have to give big kudos to not only the Steward hospitals, but to every hospital that is vaccinating right now. There are people there many hours every day just giving vaccines. And same thing for our local health department heroes that are vaccinating and will vaccinate the majority of our state. When I went in, I was day 2. The hospitals actually were very efficient at getting through all of their hospital staff, not only just the physicians, but the respiratory therapists, the nurses, the custodians, the food handlers, to really make sure that our people were safe in our hospitals as the first line. And then, the consulting physicians and their practices as our next wave. But just the level of enthusiasm and optimism. I have to say, I've never been so happy to get a shot in my life, which is sort of morbid to say. And just, the resilience of our nation to be able to stand up something so quickly and to be so effective at doing that, I think is one of the confidence markers that I want to instill on people that are listening today, is to say that a lot of really smart people have thought a lot about this and about how to do this effectively, and to have, not only the supplies ready to help distribute the vaccines, just from the needles and the Band-Aids, to also monitoring, right? Those first 15 to 30 minutes, depending on your risk, is really important. And then to have the infrastructure there that if God forbid there was a rare, anaphylactic reaction to it. I had a teeny bit of a sore arm on day 2, not dissimilar to my flu shot. And then I had, with my second shot, some slight increased symptoms, which is typical for about 10% of the population. I had a few muscle aches, and I felt tired, but I knew that it was from the vaccine, and it lasted 24 hours, and I used a little Tylenol, and it was great. So I'm back to it, and exercising, and didn't miss a day of work, and I'm wildly optimistic that others will gain confidence from that. I wasn't scared. People ask me, are you nervous about this? And no, I think that, to Dr. Dunn's point, I think there's been great research that has been done on it. And yes, the speed by which we had to do this was imperative for us to save lives, right? We have far exceeded every expectation of the number of deaths in our country, much to everyone's dismay. So the sense of urgency should not be translated to sloppiness or to in any way cutting corners. So I think that's important that people hear that message.
Great. Well, thank you. Thank you very much for sharing that perspective with us. Dr. Dunn, we don't want to make you late for the important meeting that you have with your new boss. So is there anything that you would like to share before you need to drop off?
No, I just appreciate the partnership between the business community and the health community throughout this, because we know that to effectively address a pandemic, it is not just a health response, it's also an economic response. And to protect the lives and livelihoods of all Utahns, this partnership is crucial. So I appreciate it. And I will let you all go. Have a wonderful and safe weekend.
Thank you very much, Dr. Dunn. If maybe for the rest of you, and I'll just address this to the group, and if there's anything that you would like to share with us, but today we have a lot of business leaders who are joining us. And from your view, what can businesses do to support the vaccine rollout? Do you have any suggestions on how businesses can incorporate the vaccine into our office reactivation and kind of reopening plans? Any perspective you could share would be helpful.
I'll go first. I think it's important that there's really good education out there just about the vaccine and the vaccines that are out there. I think forums such as this to dispel myths, to actually give fact, I think is important. I think there'll be questions from the employer standpoint on, is this covered by my insurance? When can I get it? What happens if I have a side effect with it? And will this affect my employment? I think are really important questions that I anticipate will come up as a part of this. And so to my business leader colleagues, I would say now is the time to really start messaging to your employees and to your health plan members about, where we are in the pipeline for getting vaccine. How do you get this right through your local health department, getting those resources out there, and just maybe some fact sheets about the vaccine overall. I think is a really good place to start.
Yeah, thank you, Dr. Milavetz. Just to piggyback, I think leadership all the way around is critical. And Dr. Dunn mentioned that in her closing comments, that we've all been in this together, and it's so critically important that to address and improve consumer confidence, to address real vaccine hesitancy, we all need to be, taking that leadership stance, communicating clearly and regularly to our constituents, whether that's within your business community, in the healthcare community, in the school system, what have you. I did want to highlight a couple key points around those who may have concerns about accepting vaccine. Certainly, we want to reassure folks that these vaccines are safe. In addition, be really clear on what the side effects are, those sore arms, the sort of myalgia, the response that our immune system has predictably within the first 3 days of getting that dose, the first or the second, making sure that we're addressing concerns of severe reactions and taking those extra steps that Rich had mentioned to monitor people for those who have a history of severe allergic response or immediate response. That's concerning, that they're monitored for a longer period of time. For anyone who has had a profound allergic response to an ingredient within the vaccine, they're not advised to take the vaccine. So really making sure to reassure that we're taking those extra precautions, and then keeping track of those safety issues by reporting through those surveillance systems. I think it's important that people understand that there's been a lot of work that has been done and continues to be done to assure the safety and the effectiveness of the vaccine, keeping in mind that, again, over 90% vaccine effectiveness is remarkable and really allows us to think about how important it is that we really quickly immunize as many people as we can to confer that level of herd immunity. And then the last piece, which I think is remarkable, is really the product of our Operation Warp Speed investment by the federal government, is that these vaccines are covered at no cost, or they're covered, if you will, through the government. The administration would be something that a provider could bill for, but that's an important piece. People want to know, what is this going to cost me, right? Am I going to be out money for this? Where do I get the vaccine? I think those are all really important concerns. And then in closing, I just say about this issue of consumer confidence, and your role as business leaders is, again, to talk about your own experience, to really encourage your constituents, your employees, their family, to get onto the website, find out where they're prioritized, where do they go to get the shot. And then as your own kind of number gets drawn to when you're in line to get your vaccine, talk about that experience. And I know that the clinical community, our healthcare providers who are so critical in this response, we look to them to advise their patients about the importance of getting vaccine as it's offered to their patients.
Great, thank you. Those were very helpful responses. And I think Dr. Milavetz, you mentioned maybe having a fact sheet or some information that we can post and share. And for Heidi and Marissa, I think that might be a good output from this webinar, and maybe something that the chamber could help to develop and distribute that information. We had a question come in through the chat about where people can find information about local health departments and how to get information about vaccine locations, and we could include that information. But just for everybody's that's on the call, if you haven't been watching the Q&A, the website is coronavirus.utah.gov. And also you can do that same address, coronavirus.utah.gov/vaccine, in order to get more information there. Rich, I'd like to come to you if we could, and have you just address a bit about the kind of essential workers and maybe how essential workers are being prioritized. We had a question into the Q&A about the prioritization for teachers and those that are exposed in our education system. If you could address those for us, that would be great.
You bet. So when it comes to essential workers, the governor has kind of made it clear that we are going to an age-based system. So in our first phase, our phase is hospital healthcare workers. So the goal was to get the vaccine to those hospitals and let them take care of their own healthcare personnel, their staff, support, anybody that they feel like was important to get vaccinated. Then we have a number, and then our other very top priority was long-term care facilities, staff, and residents, to ensure that they are vaccinated, because they have been greatly impacted during this COVID time. We wanted to get local health departments healthcare, those that are on the front lines that will be vaccinating. We wanted to get our tribal healthcare taken care of, get them vaccinated so they can take care of their tribal communities. Then we have healthcare workers where non-hospital healthcare workers, where they are able to go to their local health departments right now and start getting vaccinated. Local health departments are making those appointments. We have essential protective services. Those are your fire and your police, anybody that would kind of be in that category where they can be vaccinated, and they can also, their appointments are being made right now at local health departments to get them vaccinated. Now, moving to K through 12 educators and school staff, people have always asked, well, why have teachers been moved ahead of other essential populations? If we look at the impact that COVID has had, the school system is probably one of the systems that have been impacted the most by COVID vaccine. We've got school in and out. We've got teachers out with COVID. I mean, there's a number of different circumstances where these schools have been impacted the most. So right now, teachers starting, local health departments are already starting making appointments. So they can start on January 11th and they can start getting vaccinated. So again, go to those local health departments and make appointments. Some of the local health departments have contracts with community nursing services that will be helping to get them vaccinated as quickly as possible. Then when we are moving into an age-based system where we will have categorized ages, perhaps 70 and up, then we could go 65 to 74. And we also have 11 health conditions that will be incorporated into those age groups as we go through these different groups. We also will look at congregate living, independent living facilities, for example, assisted living, nursing facilities, group homes, any type of congregated individuals where they could spread it because they're in close quarters. So again, just to kind of summarize, as we move through phase 2, we will be going through an age-based category. And if there's any businesses that have ages that fall within those categories, then they would make appointments with their local health departments. And we will also post on our website about the 11 health conditions that would be associated with that. So for example, if an individual is between the ages of 45 to 54, but they're not in that category yet where they can be vaccinated because they're not old enough, because right now we're doing 70 and above. But if they have a health condition such as heart disease that is associated with that age group, then they could be moved up in that category to get vaccinated earlier.
Right. Rich, when do you have an idea date-wise, when do we move to phase 2?
So there's going to be a number of announcements today, and we are looking at moving up the age groups sooner than later. We had anticipated that we were going to start with age 75 in the month of February, but we are moving those ages up at a much quicker pace. So anticipate that at least from age 70 up could be well into January, mid-January of when we start that.
Right. That's fantastic news. Thank you. Dr. Milavetz, if I could address a question to you that's come in to the chat. There have been questions about those struggling with infertility and if they should get vaccinated or there are potential risks that they need to be aware of.
So there's not great data available right now on just pregnancy in general, whether you're contemplating pregnancy or you actually are pregnant. The studies that were conducted did not enroll pregnant women in them for probably clear reasons. Although interestingly, there were some pregnant women who didn't know they were pregnant at the time when they got their first shot, that some analysis has been done with them. It's an individualized decision that I would argue that those women who are currently pregnant to visit with their healthcare professional, their doctor or their obstetrician who's taking care of them, to really have that pros and cons conversation and to make an informed decision from there. To date, the American College of Obstetrics and Gynecology has come out in favor of vaccinating pregnant women. So there are some national bodies that are very pro doing that. There also is a position that if you're contemplating getting pregnant and can wait, get the vaccine first and then work on getting pregnant from an infertility standpoint.
Okay, thank you. We have another question that's been submitted with any recourse for side effects, and I think there's legislation that provides protection for the vaccine manufacturers and also those administering the vaccine, so they have legal liability protection. How would you respond to someone if they were reticent to take the vaccine because of that issue? Anybody want to address that?
Scott, when you say reticent, you mean from the vaccine recipient or the administrator perspective?
No, from the vaccine recipient.
Right. So for many
vaccine.
years now, there is a National Vaccine Injury Compensation Program, which has been set up to be able to compensate individuals who have been shown to be harmed through vaccination. Certainly that is a system that has already been set in place. We know to date, and I just heard this on a CDC call yesterday, that we certainly have seen some adverse reactions that were severe allergic reactions. Those had been caught during that period of monitoring, usually 30 minutes or so in a setting, a clinical setting where there was access to, say, antihistamine or epinephrine or other sorts of emergency support. At this point, I'm not even sure of the total, like 250,000 or so more doses that have been, that already been provided, a couple million plus. There haven't been any deaths that I have been aware of, and I think we are going to continue to monitor any longer term issues that might unfold related to the receipt of these vaccines. But there's at least a mechanism for individuals who may have or become harmed as a result of the immunization.
Okay, thank you. Another question into the chat, and Dr. Milavetz will maybe come back to you on this one. It's a question about if a mother is breastfeeding an infant, should they be vaccinated? Is there any data or information on that yet?
So again, I'll start at the 30,000 feet that I think as a medical community, we advocate breastfeeding overall, that it's good for a baby, it's good for mom, and we advocate for that. There's really very limited data out there right now on breastfeeding and whether or not there is either a COVID positive mom who's breastfeeding her child from transmission of COVID through breast milk, or any sort of passive immunity for a mom who gets the COVID vaccine to baby. We just don't know just yet. I think that there are some options for women who want to continue to breastfeed, that they're eligible for the vaccine. Is, there's pumping options and dumping that breast milk during the time where you're getting vaccinated and you're gaining that immunity, that you can continue to offer your baby and your child so nutritional supplementation during that time period, but to get through that period of time, that 14 days, if you will, where you're in that vaccination status. And I'd also like to say, just informationally, just on the duration that it takes to gain immunity, because I think that is probably a question that's out there for everyone, that, I got the first shot yesterday, am I immune? So it does take a little while to gain immunity for the COVID vaccine. For the Pfizer, 7 days after the second dose is when we're starting to see an immunity status. Again, to Dr. Kahn's, Dr. Dunn's point, we don't know how long that immunity is conferred for, but it's 7 days after your second dose with the Pfizer, and then with the Moderna one, it's typically 14 days. So you do have to wait a bit. And again, it goes back to that aspect of you need to continue to mask, that even though you are immunized at a certain time period, doesn't negate the necessity to continue to mask and to social distance and to do good hand washing, because there's still so much that we don't know.
Great, thank you. Another question that just popped in, and we're close to wrapping up. So if any of you do have questions that are listening in, please go to the Q&A and submit those. And this question is, it was mentioned that if you are allergic to some of the different items used in the vaccine, to not take the vaccine. I think there's a question about how would you go about evaluating that or know about ingredients?
It's a great question. First of all, you can go to Pfizer and the Moderna sites and they will list the ingredients, but there are sort of three principal components that are in the vaccine. The first is the messenger RNA itself. We haven't had a messenger RNA vaccine in the past, so you wouldn't necessarily know you're allergic to that. However, there are certain elements in the vaccines, both of them, that really provide a lipid layer, a sort of a cholesterol layer around the messenger RNA, which allows that to enter into our cells. Included in that are some stabilizers, if you will. One of them is called polyethylene glycol. It's used in it's an ingredient in other medications, other kinds of vaccines as well. A person might have also had a prior adverse reaction to a vaccine, a severe reaction. It would be important to understand there could be some cross-reactivity, and that's why the current guidance by the CDC is that if you've had anaphylaxis or severe allergic reaction in a previous vaccination, there could be some cross-reactivity. And for sure, the recommendation at this point is to not take the immunization because of that risk again. So you can go to those websites, a number of chemical stabilizers, if you will. The other ingredient, the third really, is the sort of what's comprised of the solutions. It's essentially some salts and some sugars and some, just the solution in which the vaccine is suspended. So I think it's important to just, if you have that history, you want to discuss that with your provider. And certainly that is the caveat for those who've already had a prior serious allergic response to messenger RNA vaccines or a component within the vaccine. I just offer one last thing. I know we're coming up to the top of the hour, but one of the questions that I get a lot, and I think it's part of the, getting the right information out, is that people will say, well, am I going to get infected with COVID-19 from this vaccine? Or am I going to have my DNA somehow altered, if what have you? I want to reassure those of you on the call, this is not an intact virus. You do not get anything that resembles a complete virus. It is a segment of genetic code that codes for the spike protein. It does not insert into the nucleus of the cell. It's actually read by one of the elements within our cell, and it degrades within a matter of hours. So there's no insertion into our genetic code or into the DNA or what have you. But that is one of the questions that I get. I can tell you pretty regularly, along with, is this going to protect us in the future from these variant strains that Dr. Dunn mentioned? It is true that viruses mutate. We don't know simply, what the future holds, but I will tell you what's been true in the science of biology and bugs is that most pathogens don't want to kill their host. And so they do evolve potentially to be more infectious, but they don't necessarily evolve to be more severe, because that would put them out of business, if you will. So in general, we do track that tightly and closely. It's possible that a mutation could occur to sort of evade our immune system. And that's the one that we pay the closest attention to, because we want to make sure that these vaccines continue to be effective, that they're conferring the right immunologic response and the production of antibodies that are going to neutralize that virus should we become infected.
Great, thank you. That was great information. We have a few final questions that have come in to the chat, and Rich, you addressed this one, but if you maybe wouldn't mind just clarifying. The question is in phase 2, will it strictly be age, or does serious health conditions maybe move somebody up that list as opposed to just their age?
Yeah, so phase 2 will be based on age, and there's 11 health conditions that were identified by CDC, and we are currently working right now to include those 11 health conditions within phase 2, within those age priorities. So that'll eventually be on our website. So phase 2 will be age-based, with the addition of congregate living areas that should be vaccinated, along with those 11 health conditions incorporated into with those age. those ages. So, for example, again, if you're in the age group of 35 to 44, but we are vaccinating 55 to 64-year-olds, but let's say you have 2 health conditions at that age, then that means that you would move up into that category based on your risk, and you'd be able to get vaccinated earlier.
Okay, great. Thank you for clarifying that. We have a question, will we need to take this vaccine annually like we do at the flu shot?
Well, we simply don't know yet, right? I mean, that is the big question. I hope not, but we don't know how long we'll have the length of immunity, how long we are going to be protected. And I'll just reference that normally, if you become naturally infected with COVID, you'll have a response with the production of antibodies. Those will stay present in your blood system, if you will, for a period of 2 to 3 months, and then they decline. We still have some degree of memory. Our memory cells, our cells that make these antibodies, have a memory, so that if we were to be reintroduced to the infection, we would still have the ability to respond and mount an antibody response. What we don't know is the level of duration of that protection that would be conferred by these COVID vaccinations. We're very hopeful that it will extend beyond a year or more, but we simply don't know until we have a little more time in the saddle, right? And a little more time to continue to measure not only the durability piece, but how does the virus change? And we also need to think about the characteristics of the person who's been immunized, right? We know that the older you are, the more sluggish, if you will, your immune response might be. We've seen that other vaccines require a booster. Perhaps this will be one that we might need a booster every so many years, but time will tell. We simply just don't have that answer yet.
Okay. This might be our last question. If we do everything that we're supposed to do after receiving the vaccination, then will travel be safe if we continue with those same protocols?
Yes, and I think that for the foreseeable future, even if you are immunized, we are continue to advocate for masking. There will be, I think, instances where showing proof of vaccination may be necessary. And so I want to encourage all of you that you will get a card with your dates of vaccination and the vaccination brand on that I would encourage everyone to take a picture of it, put it in your phone, hold on to it. It's like the old yellow cards for those of you who are moms on the call, that we always lose the yellow card. So I think there will come a time where you may be asked to show proof of that. But in the foreseeable future, I want to reiterate to everyone that masking is really still the standard, along with the social distancing and hand washing, not to diminish those two as well, but that masking really is continued to be critical, and that's also to protect others.
Right, thank you. Rich, we've had a question. This will be our last one, but the 11 health conditions, if those will be posted on the website or where people might better understand the vaccine kind of groups and prioritization.
They will. They will be posted on our website. Those 2 websites that you have mentioned, they will be posted there, and we will lay it out when we have these age groups categorized for phase 2 and how those health conditions play a role in that. So people can go to that. There'll be I'll work with the Public Information Office to ensure it's very readable, understandable, so that somebody can go in there and look and say, hey, you know what, I'm in that age 35 to 44, but I got 2 health conditions. So that means that I can be vaccinated a little bit earlier in those priority groups. So that will be on our website. And I wanted to add one other thing about, there's an app called Docket that you can actually download on your phone, and you can register, and then you can actually get your vaccination records from our registry that will go into that Docket app. And then you can do that for yourself and your siblings. And then if you are traveling and if there's any, if they're asking for a proof of vaccination, then you can have it right there on your phone through that docket app.
Great, very, very helpful. Well, we'd like to thank our panelists very much for your participation. This has been a very insightful and hopeful hour that we've shared. Thought it was interesting. Somebody posted in the chat, how do we correct a lot of the misinformation that is out there? And if anyone is on social media, you can find any view on any topic. And so I would encourage that everyone, but let's be sure as business leaders that we're sharing the facts. We can share the link to this webinar. The recording will be posted on the Chamber's website shortly, and we can share this as a source of information to hopefully help fuel people's optimism and confidence and help to get our economy and those who are struggling back on track. And that really is the purpose of our Roadmap to Recovery Coalition. If you would like to learn how you can get involved and some of the other things that we are doing as a coalition, as a chamber, please visit the chamber at our website, slchamber.com. And with that, we'll go ahead and adjourn. And again, thank you to all who have participated, and especially to our panelists. Have a great rest of your day and happy 2021.
Thank you.
Thank you.